The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul. Today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, great to see you as always.
Great to see you too, Shay.
The last time you were here with us, we talked about the usage of Botox for TMJ. Today, we're going to talk about its use in alleviating migraine symptoms.
That's correct. Migraine prevention. So,
Uh-huh.
Botox is, again, as we said the last time we were on, such an amazing medicine that we have today. Multiple uses, both cosmetic and medical. And one of the FDA approved uses for this product is migraine treatment and prevention. And we notice in our cosmetic patients who suffer from migraines that when they get their migraine and their Botox for their cosmetic treatments, one of the things they say is how well their migraines improve. And as soon as their Botox begins to wear off, they know to come in because they know that the migraines are coming back. So that's a testament to how well it does truly work. So it's approved for the use of migraine treatment, a little different than the cosmetic treatment. We do treat the areas of the forehead and the glabella with Botox for the migraine treatment. But then we also treat the temporalis, and we also treat the occipital region of the back of the head with the Botox, down even into the trapezius. So it is a multiple injection procedure where we do probably around 20 to 25, maybe 30 injection points on each side of the patient. It ranges from around 150 to 200 units of Botox for this treatment. So it's quite a large amount of Botox. The thing about migraine prevention and treatment with Botox when you go through your insurance is you have to have failed most mainstream medication for the
I've
use of
heard
migraine.
this.
Yes.
Yeah.
You have to have seen a neurologist, you have to have undergone an MRI, and you have to have so many headache days per month documented in a diary to present to the insurance company for them to approve this. So for the public out there that's interested in this and who wants to seek someone who can do this through insurance, those are kind of the steps you have to go through to get your insurance to approve it. And even still, sometimes because you're using such a large amount of Botox, it's still a costly copay or a um, I forget what they call it, but a co-insurance that can go with this procedure. So um, here, though, when we do the migraine Botox treatment, we usually start with around 150 units. The cost for the patient is around $1,500. But the results are amazing. I mean, if you have someone who has been debilitated by migraines
And
and they're getting more than, 12, 15 migraines a month, you're giving them their life back. You can't put a price tag on that. And they have such an improvement from their headaches. It is truly transformative to how it helps patients. So I just wanted to make the public aware that, hey, there is an alternative treatment. If you are out there and you have taken the sumatriptans and you've taken the new injectables that are on the market and you're still having issues, talk to your physician, your provider about what are the options of using Botox and how do we go about? There are several neurologists in town that I know do Botox uh, for medically for migraine headaches, and this can truly change someone's life. And then of course, if they would prefer to have if they prefer not to go the insurance route or the insurance won't approve it, there's always the option of coming to see us and using us as your treatment. Been doing Botox for migraines for over 10 years and have had great success with it. So I know it works, and I know it can change patients' lives who suffer severely from migraine headaches.
as you said, the last time you were here, Botox has been studied so much and so frequently over the past several years. You trust it and you know it's safe. So
Absolutely, so extensively studied, and the positive outcomes with this medication are so incredible. And the side effects, in the right hands, injected properly, the side effects are very, very low with this medicine. So there's not too many medicines on the market that have a safety profile as good as Botox does. So
all right. Good to know, Dr. Chapman. As always, I appreciate the information. Thanks so much.
thank you for having me.